Suhana. Suhana is Roni's mother. Roni has diagnosed a case of Helicobacter pylori, and she has lots of information she want to know about that, and she is not asking about the antibiotic everything. So you have to discuss. That is an information giving scenario. So you have to start or take
Okay.
time.
Yeah.
Okay.
Good morning.
Yeah. Good morning.
I'm Dr. Raja, part of child doctor team that working in this hospital. I believe
Yeah.
I'm talking to Mrs. Suhana Ron's mother. Am I right?
Yeah, you are right.
Okay, Mrs. Suhana, nice to meet you.
Nice to meet you.
Mrs. Suhana, before we are starting our meeting, are you waiting somebody to attend this meeting?
No, no. Today I'm alone. My husband go outside, so you can continue with me.
Okay. Mrs. Rohana, I'm here about, I want to discuss with you about recent result that appeared to Ronnie, with Ronnie. Before, what's your previous knowledge about this condition?
Yeah, I know he has Helicobacter pylori something. What's that?
Yes.
Helicobacter pylori?
Yes, Helicobacter pylori, it's a bug that affect, if you follow me with the drawing, okay,
Okay.
that affect if the what we call the food what we call it
Food tube.
food bag food
Yes.
bag and yeah, this is here, follow me. This is that food tube that we call it the gullet or esophagus, and the food bag is the stomach here.
Okay.
Usually the stomach is protected by a layer, yeah,
Okay.
a mucus layer, yes, that this layer is protect the stomach from the acid that affect the stomach. Okay, usually in normal population. Is it clear so far? This is
Yeah, I
Suhana.
understand that.
Yes. What
So,
happened? With this H.
mm,
pylori, yes, it is a bug that invade this layer. Okay, and
okay.
yeah, and when the stomach secrete the acid, it will penetrate it, okay? And it will,
Okay.
that's why Ronnie sometimes feel that he has tummy pain. There is bloating at his tummy, that discomfort that usually feel with eating. Is it clear so far?
Yeah, I understand. Yes, he's suffering some bloating, gagging. You are right. But what about the medications of that?
Yeah. Yes, it is a medication that you will be seen by tummy doctor, and the tummy doctor will prescribe for you some antibiotics that Ronnie takes for about 14 days. Okay. In
Okay.
addition, the medication that control the acid secretion, so he will not feel discomfort. Does it sound good for you?
Yeah, but I know that this antibiotic that affect the immunity, that's why I'm not interested to take that.
Yes, it's you. Appreciate your knowledge about the antibiotic. It's right, but yeah, it's right. But Ronnie, he has a condition that necessitate this treatment, Mrs. Suhana. He is not using it like without any cause.
But trying to tell that, every medication has some drawbacks. Is there any drawbacks of this antibiotic?
Yeah, yes, sure. Any antibiotic, he has drawbacks. Some of the drawbacks that he may have lose poo. He may have little bit. Some feel himself nauseated. Okay, later بقى شوية ماما. Okay, and some tummy pain. For a while, he will grow out this tummy pain. Are
But
you
I
with
want
me?
I'm with you, but I'm to tell you that he's still nauseating. If you're telling that I give the antibiotic, he will start again nauseating. That how does that sound?
Yes,
Still he's
it is
nauseating
the
already.
first begin. Yeah, it's the first beginning of the medication, and all the drawbacks it will resolve.
Okay, but if I not treated him, what will be happen?
Yeah, I want to tell you that his symptoms it will increase with time, and he may have what we call the ulcer, and some any unfortunately this drawback that we don't like to happen, that there will be a hole in his stomach, the food bag.
Okay, I understand that. But how can you know that this bug has gone from his body?
Excuse me.
How can, after 2 weeks, how can you know that this bug already gone from Ronnie's body?
You will find that Ronnie's symptoms is resolved, and I you will be seen already by tummy doctor. He will follow him, and he will run some blood tests to check this bug, and he can also do some poo test. He will check if there is any bug at his stomach. Does it sound good for you?
Yeah, okay.
Okay. Mrs. Suhana, I'm so happy that you start convinced to use this antibiotics and regimen. Do you have any other concern, please?
No.
Yes, thank you. Mrs. Ruhana, we discussed the results, laboratory results that came to Ronnie. We talked about the H. pylori and the treatment with using antibiotic and some medicine to control the acid secretion that will help him. And I will arrange for you meeting with a tummy doctor to elaborate more with you about Ron's condition. I will give you some written leaflet and trustable website to read more about this subject. Okay, and I want
Okay.
to highlight for some point of view that if the tummy pain is increased or he has a recurrent throwing up, you can contact urgently with take medical advice urgently. Is it okay
Okay.
with you?
Okay.
Okay. Thank you for your patience, Mrs. Suhana.
Okay. I'm not Mrs.
Okay.
Suhana. Oh, yes, I'm Mrs. Suhana, Ronnie's mother.
لا سهان انت
Okay.
مرة
Okay, I forget. I think I'm a teenager. Okay. So I want to tell
you
you, how
are
can we do
you
that?
are Suhana for a long time ago.
Okay. So I'm telling how can we get that is a Helicobacter pylori information giving scenario. So how much do you know about Ronnie's conditions? I know he has Helicobacter pylori. So what is Helicobacter pylori? I really understand your feeling and I'm really sorry for that. I'm gonna tell you everything about it. Please follow me at this drawing to make myself clear. Imagine with me, this is the food tube and this is the stomach. Normally in the stomach, what happened? There is a very big, strong medical substance called acid. This acid helps to digest food particles because it is strong. It may harm the stomach wall, and that is why stomach wall is covered by a thick protective layer. Am I clear? But what happened in Helicobacter pylori? This bug, which called Helicobacter pylori, weakens this protective layer, make the wall more prone to the harmful effect of this acid. I hope I am making myself clear. Oh, mother, okay. Now, this is why Ronnie has bloating, gagging, heartburn, and tummy pain. Okay, what is the medications? We'll give him two antibiotics and one drugs to decrease the acid in the stomach. How long? So actually it is 1 to 2 weeks. Okay. So two antibiotics for 2 weeks. This gonna affect his immunity. Here, the answer of this. That is, ma'am telling, let us weigh the benefit against the risk. Any medicine has its own drawback, but we'll keep him under control and keep monitoring him. So what are the drawbacks? Nausea, throwing up, and some metallic taste in the mouth. He is already nauseating. If we give him these antibiotics, he may suffer and may not from the nausea for a little period of time, and after that he will be okay. But on the other hand, if we did not give him antibiotic, he will suffer from these symptoms for a long period of time. Are you with me? Okay. And also this bug, if not treated, it may lead to formation of wound in the stomach, which called ulcer. And this will increase the symptoms and it will increase the drawbacks of this bug, leading to bleeding, anemia, and deterioration of the school performance. Am I clear? Mother, okay. And if the ulcer present for long bone, it may lead to a hole in the stomach, which is really serious surgical conditions. So how can I know the bug is gone? We'll do a poo test 4 weeks after finishing the course. Somebody trusted website leaflet, or sometimes they tell that my cousin has cancer, then we tell that there is no relationship between that or like that. Okay.
Yes. There is